Hello, everyone, and welcome to today's invited speaker event. My name is Sama Bilal. I'm here on the faculty at the UHC, and today I have the honor of introducing Dr. Tarik Benmarhnia, who's currently associate professor in the School of Public Health and Human Longevity Science and on the Scripps Institute of Oceanography, both at UC San Diego. Tarik obtained a joint PhD in epidemiology from both the University of Montreal and the University of Paris South. Sorry, I was going to say that in French, but that wouldn't have worked. After that, Tarik went on to do a postdoctoral fellowship at McGill University of Montreal. Tarik is a climate epidemiologist interested in the effects of climate change on health, but also on environmental justice and on the use of innovative methods and on data science. And as a little bit of summary of his career, Tarik has published more than 130 papers, and I will argue he's a Swiss Army epidemiologist. I'm saving this term for just a few people. I once read that Isaac Asimov, the science fiction writer, was the first and only person to have written books on every potential library category. And I truly believe that Tarik will be the first epidemiologist to have published on every subfield of epi, as his contributions extend many areas of public health. So please feel free to write the questions for Tarik during the talk, which I'll then be moderating and asking those questions. Or if you are in the room and you have a question, please raise your hand at the end, and Zach will take care of moderating that. Just as one extra thing for the students that are either in the room or remotely. There will be a meeting with Tarik from 12:30 to 12:55, and for the students, masters or PhD students or whomever is over there, if you want to join that, just come back to this room at 12:30. Okay, so the floor is yours, Tarik, and welcome to Drexel and the UHC.
Thank you so much, Sama, and thank you so much, everyone, for the invitation. And yeah, and I'm really happy to be virtually with you. So let me share my screen. And okay, so okay, does it look good? Okay, awesome. Okay, so yeah, so again, thank you for having me. So today, I thought it would be a good idea to talk about some kind of new topics in relation to how different type of climate sensitive exposures, air pollution, and different type of infectious diseases are going to play together to lead to different type of health impacts, and how we can understand the different type of mechanisms. And the idea today is really to discuss together about different type of new questions that could be interesting to address in the next, in the near future, and to better understand how climate change is going to impact population health, kind of synergistically, kind of impact population health with different other type of social determinants of health, and what we can do about that. So today, I would first just briefly talk about the links between climate change and population health, just to highlight the many different mechanisms that connect climate change and population health. But I will be very brief, because obviously I could talk about that for hours, but I would just to say that the problem with this literature so far is that most studies focus on exposures or climate sensitive exposure one by one. And today my goal is really to show how actually there is a lot of opportunities to study different type of exposure together, or study like multiple exposure in and why this is important to understand this connection. And I will take two case studies today. I will first talk about extreme heat and tropospheric ozone as a case study to explain the different connections between these two climate sensitive exposure and how we can study them. And I'm going to present two papers about that. And then I will talk about the links between infectious diseases and climate sensitive exposure, such as temperature, precipitation, and so on. But I will mostly focus on the links between environmental determinants of health and COVID-19 incidence and severity. And I will talk specifically about the links between COVID-19 and wildfire smoke. Okay, and I will also use this opportunity to talk about different type of methods and the methods that are not used enough in environmental epi, and we just show how we can leverage different type of methods to study this type of compounded impacts. Okay, so first, and you probably all know that, just the links between climate change and population health. So first, what do we mean by climate change? Just to be sure we're all on the same page. So climate is just the statistics of weather observation, so temperature, precipitation, etc. So when we talk about climate change, this is simply a change in the distribution of weather observation. And this change in the distribution can take place by a shift in the distribution, having more extremes, etc., but also in a variability. And that's, for example, very important for precipitation, where we talk about a change in precipitation regimes that will be associated with many issues, such as like the increase in, in wildfires here in California, for example. But overall, yeah, climate change is going to exacerbate different type of what we can call a climate sensitive exposure, and to interact with different type of social determinants of health to explain and to lead to a lot of health issues. And there are many issues that have been documented in the past, like about how climate change is going to exacerbate like the impact of vector-borne diseases like dengue, Zika, malaria, etc., or other type of issues related to waterborne diseases after flooding, after hurricane, etc. So there is a lot of literature. And one way to, I like summarizing the links between climate change and population health like that by setting climate change just as a context that will first exacerbate existing weather condition and existing issues, which means that also because we have a lot of environmental health inequalities that are taking place for most of this issue, it's also important to think about climate change as something that will exacerbate these inequalities. So that's something very important when we are trying to see about what's happening, what will happen, and how we can design adaptation strategies. But climate change is also going to lead to like unprecedented situation. A good example of that is vector-borne diseases because of change in temperature conditions and precipitation regime that may lead to ideal situation for specific mosquitoes, for example, that could be vectors for specific viruses. So that's basically how I like summarizing the links between climate change and population health. But today, I will mostly talk about how, instead of focusing on one specific issue one by one, we can also try to expand that and try to see the connection between different types of climate sensitive exposure. So that's the goal of today. So there are many different types of framework, and I just put this one from the APHA that summarizes the diversity of impacts. But you can find a lot of different frameworks in the literature. Okay, so first I would like to talk about one specific dimension, and you probably know that like social and environmental determinants of health are going to act synergistically to explain like inequalities in health issues across different communities. And in environmental justice studies, we distinguish typically differential exposure and differential susceptibility. So by differential exposure, we just mean that some communities will be systematically more exposed to some environmental determinants, such as traffic-related air pollution, for example. Whereas differential susceptibility is more about when you have two communities that will be exposed to the exact same amount of, let's say, NO2 or any type of traffic-related air pollution, but one community will suffer more as compared to the other community. And that will be explained by different other types of social determinants of health that may modulate this risk. And that's why in the literature, there are many studies showing how individual or contextual socioeconomic status variables, such as like education, income, or contextual education, income, and or race ethnicity, or race ethnical composition in a specific neighborhood, or racial segregation, for example, how that may modify the effect of such type of climate sensitive exposures or air pollution and health issues. I just will put these two like systematic review examples, one about ozone and one about extreme heat, showing how there is like a lot of evidence about how specific SES variables or race ethnicity is modifying the effect of ozone on different type of health outcomes, or something for extreme heat. So in addition, there's also a lot of literature showing how the interaction between different type of climate sensitive exposure and like air pollution and extreme heat, for example. But that's what I would like to talk about today first, just about how we can expand this work and how we can better understand this kind of synergistic impact between multiple climate sensitive exposure, like in a mixture approach. So first, and very briefly, I will talk about just what we know about extreme heat and ozone, and I will mostly talk about the links, how we can understand the links between extreme heat and tropospheric ozone. I talk about tropospheric ozone just as opposed to stratospheric ozone, which has nothing to do with public health directly. So as you know, extreme heat is by far the weather event that is responsible for like the highest number of deaths and hospitalization in the US. We estimate more or less that 12,000 to 22,000 people are dying directly from heat every year in the US. And that is mostly through like indirect mechanisms and not direct impact that will be directly coded with like the ICD 992, which is heat-related illnesses, because when we count this number, this is like between 600-700 every year, people dying directly from heat, but actually that most of the mechanisms which heat is going to be impactful is through the exacerbation of pre-existing conditions, including diabetes, cardiovascular diseases, respiratory conditions, etc. So the burden associated with extreme heat is substantial. Another thing that is important is when we talk about heat, this is not a simple exposure. And this is not, again, a one-size-fits-all exposure. There's so many types of extreme heat events, and we need to understand, address them and understand them comprehensively. For example, we can talk about different types of flavors of extreme heat. We can talk about nighttime heat waves that will be mostly driven by humidity. We can talk about like daytime heat waves that will be last like 2, 3, 4 days and so on. And each of these extreme heat events will have a different impact on different communities and will require different type of policy responses. But obviously, I'm not going to talk about too much about that today. But that's about heat. Then ozone, tropospheric ozone is a gas, a secondary pollutant, and it's a gas, and that's a very powerful oxidant that can like kind of strongly impact the respiratory system. And there are many, like hundreds of studies showing how short-term exposure to ozone is associated with many respiratory outcomes or premature mortality. And both of these exposure are climate sensitive and will be exacerbated by climate change. And now I would like to talk about the links between the two potential links between these two climate sensitive exposure. The first one that is obvious is just about a potential interaction between these two exposure and to explain a potential synergistic impact on different type of health outcomes. So as I mentioned before, and there is this recent systematic review summarizing studies that investigating a potential interaction between extreme heat and ozone. And overall, the results are relatively mixed. When you look at this literature, it's not consistent at all. And one thing that I wanted to note is that most of the time, these studies, or if not always actually, they don't specifically clarify if they're interested more by interaction question or effect modification question. And that matters when you think about it. Another thing is most of these studies also looked at this potential interaction at a very large scale, at the city level or country level or region level or county level in the US, for example. And I will show you in a few slides how actually this type of interaction between extreme heat and ozone can take place at a very, very small level. And for example, we can see that zip codes to zip codes, this type of interaction can change. And I'm going to show you some work that we did in California showing how the very important spatial variability in this type of synergistic impact. And yeah, and another thing that is important when we are trying to formulate potential recommendation about what to do is to think about the type of scale that we want to address and want to estimate. And you're probably all familiar with why in public health, most of the time, the additive scale is a scale that we care about to identify what type of conditions should be, or what type of communities or conditions should be targeted in priority. So that's the first dimension that I would like to talk about. The second dimension is about the kind of the connections between extreme heat and ozone, because ozone is a secondary pollutant that will be generated by a combination of specific, what we call precursors that will include NOx, NO2, and it also needs sunlight and extreme heat. So, which means that when you think about it, ozone is a mediator between extreme heat and different type of health outcomes. So of course, there are many papers that proposed this connection and suggested that ozone and heat should be studied with this specific framework, this specific type of causal framework. But however, there is no empirical evidence. And we're going to show you a study that we conducted in France, where I'm from, showing how ozone can mediate the relationship between extreme heat and mortality, and how this indirect effect, or the proportion mediated, varies a lot between cities. And I'm going to show you that. So that's the two type of connections that I would like to talk about today in relation to extreme heat and ozone. So first, I would like to summarize this paper that we did, and that was published last year in PNAS, where we first wanted to propose a new method, a new spatial temporal approach to study the joint impacts of extreme heat and ozone, but it can be applied to any type of exposure, and it can be applied to multiple exposure as well. But we applied that in the context of extreme heat and ozone. But the most important thing is that we did that so we can have this type of interaction at a very small scale, at the zip code level in this context, and on additive scale. And I will explain this method later. And we also wanted to address, or to identify, to understand what type of contextual sociodemographic characteristic may modulate this spatial variation in in the interaction between extreme heat and ozone. Why do we see this spatial variability? So very briefly, we use different type of data sources to estimate different type of extreme heat condition, different type of ozone peaks, and we use different type of products. But I would just focus on two type of definition just to simplify today, but we use and compare many definitions of extreme heat and ozone. And we define this type of condition zip code by zip code. So each heat wave will be defined according to the specific zip code distribution. And then for the health outcome of interest, we focus on respiratory hospitalization. We use OSHPAD, which is the main organism in California that provide this data, and we focus on all of the ICD code related to respiratory conditions. Okay, so briefly about the approach. So what we wanted to do is to propose a new approach that will be as flexible as possible, and we propose this kind of that could be seen as a spatial extension of a case crossover design. So the idea, very briefly, just intuitively, is that for each event day, let's say today we have extreme heat in a specific zip code, we identify eligible control days that will be days within the same zip code and during the summer. And then we kind of applied a weighting approach to give specific weights to other days according to the distance to the case, let's say the event day, but also to make sure that days that will be on the same day of the week will be will have a higher weight, basically, like what we do in a time stratified case crossover, basically. But then what we did is for each kind of match pair between an event day and this set of weighted control days, we calculated risk ratio and risk differences by comparing the rates of hospitalization in these case days and the set of control days that will be weighted. And we did that for different type of exposure, like extreme heat, ozone, and when we have a joint event. And we were able, using that, to simply calculate an area array, which is a way to calculate departure from additivity, like additive interaction. So once we had that, we were able to estimate for all of these events for each zip code, potential to quantify the interaction between extreme heat and ozone, focusing on specific definition. And then what we did on top of that is also to combine this approach with the Bayesian hierarchical model. And we did that first to deal with spatial autocorrelation, because as you know, there is a lot of spatial autocorrelation in hospitalizations that are not only due to extreme heat and ozone. So we wanted to deal with that. But on top of that, we can also use the information for improving the precision about our estimates to kind of estimate our confidence intervals. We don't have to assume for each zip code to start from scratch. We can use information about the surrounding zip codes, and actually that will be very helpful to improve the precision in our estimates. So, and then once we have that, we also conducted a random effect meta-regression to try to understand the type of characteristic at the zip code level that will modulate the spatial variability in this additive interaction that we calculated using the area array. We also posted all of the codes to replicate everything. So if you're interested to apply that, we have all of the syntax here. That is supposed to work. It's supposed to be relatively straightforward and clean, I hope. Let me know if it's not. So just quickly some results. So here, this is on the left. You can see just the variability of the this estimation of the error, which again is just an estimation of departure from additivity. So this is just something that we typically use in epidemiology to estimate additive interaction for multiplicative models. And here you can see there is a lot, like a very important spatial variability in this additive interaction across California, the zip code, and we have some hot spots here, and you have some cold spots as well. And what we did next is to try to understand which zip code characteristic may influence, modulate this additive interaction. And here you can see, for example, that chronic exposure to air pollution like exacerbate this interaction, where, for example, a proportion of people that are biking or walking to work is going to reduce this intensity, or economic composition characteristics such as median income also attenuate this potential interaction. So anyway, so that was just the first type of studies or connections that I wanted to present to you about how we can understand the links between a different type of climate sensitive exposure, and I focused on extreme heat and ozone, but again, that could be easily extended to wildfire smoke and extreme heat, wildfire smoke and ozone, and so on, multiple exposure technically. So that was the first kind of mechanism. The second one that I wanted to talk about was about how we can study ozone as a mediator between extreme heat and mortality, for example. And I'm going to present this paper that is probably going to be published in the next few months, hopefully, where we wanted to decompose the effect between extreme heat and mortality, again, using different type of extreme heat conditions, and see to which extent ozone was contributing to this mechanism, and what was the indirect effect coming from ozone, because ozone will be generated will be increasing when heat will be increasing, and we want to understand this specific connection. And we want also to compare this proportion mediated across French agglomeration. So we focused on 15 cities, and you can see here different cities that we focused on in France, and in Paris and different cities. Montpellier is where I'm from. And and we use different type of extreme heat definition, but today I'm going to focus mostly on the main official Météo France definition, just as a case study. And and we use different source of data for air pollution. And today we just focus on non-accidental mortality as a main outcome, but we focus on respiratory and CVD causes of death as well. So very briefly about the approach. So what we did is just a very simple mediation analysis under a potential outcome framework, just to clearly define the estimates of interest. And we were interested by natural direct effect and natural indirect effect. And also be careful about specific identification assumptions, including unmeasured confounding, but also making sure that we didn't have some confounder between the mediator and the outcomes that will itself be induced by the exposure, and to carefully deal with that. And we have different approaches to deal with that. Also, we didn't, on the additive scale, identify any interaction in this specific setting in France between the mediator and exposure, between extreme heat and ozone. So basically, natural direct effect and controlled direct effect are the same quantity. So very briefly about how we can apply the product method, for example, to do this type of decomposition is just by running two sequential regression, one outcome model and one mediator model. So the idea is to first run an outcome model where we include the exposure of interest and a mediator and a set of confounders to deal with seasonality, etc. And we're going to save two specific coefficients, one coefficient θ1 for the exposure and another coefficient θ2 for the mediator of interest. And then we're going to run mediator model, where the mediator will be the dependent variable, and we're going to save beta1, that will be the coefficient, representing how heat is going to increase ozone. And we can combine these two coefficients about how heat is going to influence ozone, and then how ozone is going to influence mortality, conditioning on heat waves on the exposure. And we can calculate this product and to estimate the natural indirect effect. And the direct effect, the natural direct effect, would be simply the θ1. And here we're on a multiplicative scale, so we just use the exponential of this coefficient to get the risk ratio. And we can calculate the proportion mediated by following this formula, just to quantify to which extent the total, the proportion of the total effect that is explained by the indirect effect. Again, we have all of the codes here to replicate or produce this type of study elsewhere. And that's what we found. So here we have just a forest plot for the total effect across all of the cities, a natural direct effect and a natural indirect effect. But here, this is just, I put that as a summary just to show the proportion mediated city by city. And that's proportion mediated means how much of the total effect between extreme heat and mortality is actually explained by an increase in ozone because of heat on mortality. And the most important finding here is just to show that, yes, there is like some mediating effect of ozone, but also there is a lot of variability across cities in relation to this mediation effect. And that, I think, something that will be interesting, especially in relation to how we formulate policy, because when you have cities such as Nantes, for example, where most of the heat burden is actually explained by, is explained by a generation of ozone, it would be a good idea to not only focus, like doing a warning system in relation to heat, to not only focus on like exposure to heat, but also to try to reduce emission of precursors of ozone. And that's something that could be interesting to kind of update and revisit different type of warning systems. So that's what I wanted to talk about in relation to extreme heat and ozone. And I wanted to show you this second type of question that we can be interested by to better understand the mechanism linking extreme heat and ozone. So now I'm going to switch gears and talk about a very different topic. And I would like to talk about the connections, the links between infectious diseases and climate sensitive exposure. And I will mostly talk about COVID, but I just first wanted to give you an overview about the different connections between infectious disease and climate sensitive exposure. So as you know, there are many infectious diseases that are directly driven by environmental factors that themselves will be exacerbated by climate change, including precipitation, temperature, etc. So of course, many or most, I would say, vector-borne diseases are going to be sensitive to weather. And we can talk about dengue, West Nile virus, malaria. And just to give you one very simple example about some work that we did with Gabriel Carrasco Escobar in Peru, just showing how this figure just show like the y-axis is a slope. This is a slope representing the link between temperature and the incidence of malaria. And this is like the gray period is a period in which there was an intervention in place in Peru. And here this is just to show how the dose response between temperature and the incidence of malaria changes with time. And we can see here how this dose response relationship decreased at the end of the intervention period, but just went back to kind of standard levels after the intervention has been stopped. But it's just to show but there is literally thousands of studies showing the link between precipitation, temperature, and malaria, dengue, Zika, etc. There is also a lot of work about valley fever, and I'm not going to try to pronounce the real name because that would be just embarrassing. But there are a lot of connection between droughts that will be leading to dust that will then help transporting this type of issue. And you also have a lot of literature showing all of the kind of the consequences post-catastrophes, including extreme weather events like flooding, hurricanes, etc., showing links in relation to vector-borne diseases, but also waterborne diseases, etc. And finally, you also have a lot of literature about showing how seasonal influenza and other type of respiratory infectious diseases are going to be exacerbated by air pollution or exacerbated by climate sensitive exposure, like temperature and precipitation or humidity, for example. And of course, there is COVID-19 and climate change are two crises that are colliding. And this is what I would like to talk about. That's the second type of dimension that I wanted to talk about. And I will take a few examples just to illustrate how we can approach this type of connections and how we can study these questions. So do I have time? Yeah, okay. Just very briefly, I just wanted to summarize a little bit what we know about the links between influenza and climate sensitive exposures, because that is something that is this evidence can be useful to understand what we can do and what we can better understand in relation to COVID. So first, there is typically in the US at least, the flu season has a very strong seasonality and typically starts in October to December and will end in February, March typically. And just a fun fact about where the word influenza is coming from. Just thought it was funny to know where names are coming from in general. And in the literature, trying to link seasonality and climate-sensitive exposure and influenza, there are three main mechanisms that are proposed to explain why we see such seasonality in the number of incident cases of influenza. The first one is just about social behaviors during the winter season, where people are going to spend just simply more time inside, and will have more interaction and will be exposed to more, to more viruses, basically. The second mechanism is also an alteration of the immune system, about where during the winter, the immune system will be kind of weakened and may lead to a higher probability of being infected and have severe symptoms. And finally, there was also some literature suggesting, I'm going to show you a few studies about that, how the virus actually may better survive in some specific weather conditions. And on that, actually, most of the literature focused on temperature and humidity. And to date, most of the evidence indicate that humidity is a very, very strong determinant of the incidence of influenza. And that's just a study conducted in the US from a few years ago, just showing like the kind of this nonlinear relationship between humidity and influenza incident cases, and same thing for temperature. So there's also this very interesting study showing how the link between macro scale climate patterns, including El Nino, La Nina, and showing how the biggest influenza outbreaks were systematically following La Nina conditions. There is this paper that I found very interesting, and there is a lot of ongoing work right now about trying to understand this type of kind of macro scale connection and influenza and other type of issues as well. So I just wanted to summarize very briefly this literature just to give you an intuition about the type of connection you can think about. Another type of connection that I think is very important and under studies, in my opinion, is the seasonal to subseasonal connection between influenza or other type of respiratory conditions or infectious diseases and extreme weather events. Because of course, there is a lot of rationale to study to see how specific extreme weather events like cold spells, for example, or atmospheric inversion that will take place in some regions during the winter may interact with influenza, for example. That's relatively obvious. But then there is also another connection that I think is less obvious that I would like to talk about, just about something that I could call like a population level competing risk framework. Let me give you two examples to illustrate that, including one paper that was published recently. When you think about like heat waves, for example, that in the US, for example, where there will be a strong seasonality. So at the beginning of the summer, that's where the heat action plan is going to be activated, and we will have, the first heat wave. But one important connection is to see how, like, what will be the population at risk at the beginning of the summer when the first heat wave is going to take place. And one thing that is not considered at all is about what happened a few months before during the influenza season. And as populations that will be mostly susceptible to extreme heat and influenza are basically the same, this is very important to understand this connection and see if, for example, we have a season in which influenza season is relatively mild, or the vaccination was extremely efficient. It means that we'll have a higher proportion of people that will be susceptible when the heat wave season is going to start. And the opposite works too. If we have a summer season in which we didn't see too many heat events, we may be ready for the following influenza season because we'll have a higher proportion of people that will be frail and will be more susceptible. And we need to kind of make these connections. And that's why I think you can think about this type of connection like a competing risk framework, but like ecologically. There is another connection that actually has been studied and has been published last year, a very interesting paper showing how the connection between wildfires and influenza, showing how actually influenza delayed the potential impact associated with wildfire smoke and wildfire smoke PM2.5 specifically. So just to show that this is a very, very emerging topic of interest, and I think this is important to consider specifically in regions where there is a strong seasonality between some infectious diseases and different type of extreme weather events. But the main topic I wanted to talk about today in this second type of questions is about COVID-19 and climate change, which to me are colliding crises, because a population that will be more severely impacted by COVID-19 and climate change are systematically the same, and it's not random. And so we need not only to kind of highlight that and try to understand the structural determinants, the structural reasons for which this communities are going to be, some communities are going to be systematically impacted by different type of issues, but also to understand the connection and to see how we can better understand this mechanism and how we can design appropriate policies. Okay, so first I will just give an overview about what we know so far, because obviously that's an emerging topic, but what we know so far about the environmental factors influencing COVID-19 incidence, but also COVID-19 severity. So there are many environmental factors that have been studied to date, and there is a very recent systematic review published like a few weeks ago, summarizing this literature to date. Of course, it changes very quickly, and in the last few months, like hundreds of papers have been published in this area already. But most of the literature from this systematic review focused on built environment characteristics, about like focusing on green space, focusing on different type of walkability indexes, etc., focusing on temperature, humidity, air pollution. And there are basically two types of questions, just to summarize this literature. The first type of question is to which extent environmental factors contribute to an increase in infection rates, because as you know, COVID-19 is an airborne disease, and the virus will be transported through aerosols from different sizes. So the idea is that does a higher level of air pollution, and PM2.5, for example, is going to increase the potential infection rate, for example, in a given context. Another type of question is about to which extent environmental factors are going to exacerbate COVID-19 symptoms among people that already were infected, and to see if you are exposed to higher level of air pollution, for example, do we have a higher probability to end up at the hospital, in an ICU, or to die eventually from COVID. And there are different types of mechanisms that have been proposed. The one that I just mentioned about how transportation and survival of the virus would be driven by the like air pollution, for example, and the concentration of aerosols, which is, again, the main mechanism through which COVID-19, or the SARS-CoV-2 is transmitted from people to people. Another mechanism is about behaviors that will increase transmission and exposure to the virus. As I mentioned, another mechanism is about how pre-existing conditions that are could be explained by a long-term exposure to chronic exposure, to air pollution, for example, may exacerbate on some symptoms. And I will talk about that in a few slides, and how this long-term exposure to air pollution may alter the immune system. And again, I will talk about that in a few slides. So again, there are a lot of literature in this area, but today I would like to focus on one specific connection, just to give you an idea and an example about how we can understand these links and how we can study them. And we'll talk about the links between wildfires and wildfire smoke specifically, and COVID-19 severity. So just some rationale about why we can expect this type of mechanism. So as you probably know, so mechanisms which an exposure to PM2.5, for example, fine particles, are going to impact human health is through different mechanisms, including inflammation, including oxidative stress, but also through an alteration of the immune system, because depending on the composition of PM, specifically when PM is composed with a high level of iron, that may attenuate the activities of macrophages. And that is going to be a bad idea, to attenuate the respiratory immune system when you're exposed to a virus such as SARS-CoV-2. Another mechanism that has been suggested in the last 2 years is to how a specific receptor for SARS-CoV-2, SCE2, is actually its expression is exacerbated by a long-term exposure to PM2.5, and that will be another mechanism through which long-term exposure to air pollution, and specifically PM2.5, may exacerbate the symptoms and may exacerbate the probability of being infected. So yeah, of course, there are many papers that have been published in the last 2 years trying to find a connection between air pollution and COVID-19. I would not say that most of them were particularly well conducted, but there were a lot of studies that try to understand this mechanism and try to rely on these physiological mechanisms. And today, again, I will just talk about one example, which is wildfire, but there are many potential questions that could be interesting to investigate in this area. Okay, so first, it's cold now. So first, a study that I wanted to mention is just about in Nevada this year, which published last year, showing how during wildfire event, again, wildfire, the reason for which we'll talk about that is because wildfire is going to generate a lot of smoke, and the main constituent of smoke is PM2.5 because it can be transported very far away from where the fire is taking place. And what they found in a study in Reno, Nevada, is that actually during the fire, the positivity rate just increased following this specific mechanism that I mentioned before, just about the higher the concentration of PM2.5 will be, the higher the probability of SARS-CoV-2 will have to stay suspended and to contaminate individuals. And they show that the number of positive cases just like drastically increased during this fire. Of course, there are potential other mechanisms that could explain this link, not only the kind of aerosol mechanism, but also the fact that during the fires there are a lot of stay-at-home orders and a lot of warning system that may also exacerbate this mechanism. But that's just one study. But I also wanted to talk about one study that we just recently published to try to understand how taking the August-September 2020 wildfire in a Bay Area in California as a case study, trying to understand how an exposure to this huge amount of PM2.5, we're talking about hundreds units of PM2.5, how that may have exacerbated the symptoms associated with COVID-19 infection. And the idea here is to try to see how being exposed to a high level of PM2.5 through wildfire smoke may lead to a higher probability of dying. And we estimated to the case fatality ratio as our main metric of interest. And we tried to see to which extent after the fires, this quantity increased in relation to a set of control groups that we identified that were not exposed to wildfire smoke, but had a very similar patterns in terms of COVID infections and COVID hospitalization and death. So what we did, we used an approach that is very common in policy evaluation, that is based on the idea of synthetic control method. And the idea of a synthetic control method is just to try to identify when you have a set of control groups and you can't find a good control group like what we will do in a setting of a difference in differences setting, for example, you're going to build your own control group basically by a weighting procedure. And the idea is to try to minimize the difference between a treated group that in this context was a county that was exposed to wildfire and all of the other counties in the US that were not exposed to that. And we're going to, through a weighting process, try to build this synthetic control group to try to understand what will have happened in the absence of the wildfire smoke event. Again, if you're interested by the syntax, everything is here. If you want to replicate that as well, to reproduce it within the same data, everything can be found here. And that's just like to show you some of the main results on 6 counties. And here you can see, first of all, that's, for example, in Alameda County. That's where the fire started. And here, this is just the kind of intensity of smoke. And here, first of all, you can see that you have a very good match between the control group that we constituted using this specific weighting procedure and Alameda County in terms of case fatality ratio. And we use a lot of covariates to build this entity control. And here you can see that after the fire, in Alameda County at least, the case fatality ratio drastically increased as opposed to the control group. However, in other counties, we didn't see the exact same pattern. In Contra Costa, for example, we didn't see the pattern at all, and same thing for other smaller counties. In San Francisco, we also observed an increase in the case fatality ratio a few weeks after the fire, but this is just to show that there is a lot of variability, and this is also mostly to illustrate how we can study this type of connection between COVID-19 and wildfire smoke. So I will stop there. And thank you. And I think I'm right on time, exactly on time, 45. So I guess we have time for question. And I hope it was interesting. But the goal today was really to just give you some ideas and intuition about how we can move from studying climate sensitive exposure one by one and try to make bigger connection between this climate sensitive exposure and other type of dimensions that are kind of connected, of course, because the same population is systematically impacted, and this is not random. And we need to understand this non-randomness, basically. So that was what I had to say. So
thank you. Okay. So we have some time for questions. I don't know if there are any in the room at this moment, but I see 2 in the chat. So maybe we can start there while we figure out the room part. So first question I see is from Leah Shinasi, that's asking, what are your thoughts on adjusting for PM2.5 as a potential confounder in analysis of associations between heat and morbidity and mortality outcomes? And I see Leah with her camera on. I don't know if you want to expand on the question or not. But...
Thank you, Leah. And I can see
about it. I mean, it's just sort of an issue that always comes up. And since you were talking about mediation by Ozone, I thought I'd ask about that.
Mm-hmm. So the question is, when the main exposure of interest is heat and you have a given health outcome, and what to do with PM2.5? I honestly, unless it depends how you can deal with seasonality also, but if most of the time it's relatively straightforward to deal with seasonality, but I would say that you don't need to condition on PM2.5 because so it's not like a direct rationale for thinking that a condition on PM2.5 will close any backdoor path, so that will that may help for better identification of the effect of extreme heat on a given health outcome. So overall, I would never recommend to adjust on any type of air pollutants when the main exposure of interest is temperature. I don't see a good rationale for doing that as soon as you can deal with seasonality appropriately. So, and for ozone, because for example, you can adjust for it, but in a context when you want to estimate a controlled direct effect or natural direct effect eventually. Otherwise, I don't see why you would adjust on any air pollutants when the main exposure is temperature. This is opposite, of course. There are a lot of reasons to adjust in temperature when the main exposure of interest is air pollution, but not necessarily the opposite.
Yeah, I absolutely agree. It's just interesting because I feel like every time I write a paper or a grant, that always comes up. And do you have the same issues with?
Yeah, I have a paragraph that I copy paste for that when I review a paper. But I have for that and same thing for Expedia, that I see that a lot. But as soon as, but in my experience, as soon as I explained that, it worked out. So I can send you my magical paragraph.
Thanks.
Thank you. So we have another question here in the chat from Richard Ramillo. It's asking, in your PM analysis, did you explore the role of lagging from using lag-derived natural and controlled direct effects? If so, was there any PM attenuation from longer lags?
Can I ask what PM analysis specifically? The wildfire one?
No, I'm sorry. So that was more specific to your proportional mediation analysis. So yeah, just kind of, I'm sorry, it was a loaded question, but I think there was kind of maybe 2 sort of things I was trying to tackle at was, one, how do you address temporality with respect to temperature and ozone production? So if there was like a lag 2 for temperature and then lag 1 for ozone, and lag 0 for effect. And then second, since there is this sort of, temporality, did you consider maybe lag, as far as like a 2 days cumulative sort of effect? So in that way, the temperature effect on ozone is a little bit more represented.
Okay. No, that's so. Just to clarify, for the heat, like the mediation analysis, we didn't consider PM at all. We considered NO2, so because as a confounder between ozone and mortality, so as a confounder specifically, but we didn't consider PM at all in this analysis. And then for lag, that's a very good question actually, because there is obviously a lot of literature showing the variability in the lag effect for temperature and also air pollution. So for temperature, we addressed that just by the way we define the type of extreme heat event. And then we, of course, considered like lagged outcomes, to not only focus on to which extent a heat event is going to send people to the hospital or lead to premature deaths on a given day, but also on the following days. So, and if I remember correctly, like overall in France, because there is a lot of variability between cities, it goes up to 3 to 5 days, basically. That's kind of the lag time for extreme heat. And then for ozone, so we also explored lagged effect, and that was a little bit tricky for the mediation analysis, but we were able to combine this estimate with a distributed lag model, as you're probably familiar with, just to try to for each event, we can also consider not only the cumulative effect of the temperature, like the kind of lagged exposure, but also the potential interaction between this lagged exposure and the exposure on a day of interest. So we were able to do that. And we also tried to investigate the lagged effect of NO2 as a confounder, because we also wanted to, because the formation of ozone doesn't take place just like in a few hours right away. So we also wanted to consider the fact that emissions of NO2 in the days before may also contribute to higher level of ozone on a given day of interest. So we consider that using distributed lag models definitively. Yeah. And I guess that's does it answer your question?
Yeah, well, I guess as far as what was there, did that matter? Did lag have some sort of attenuation, or did it have some kind of notable trend?
Yeah, absolutely. We as I said, we did identify up to 5 days for some cities for heat, which means that 5 days after heat exposure, we still see an increase in mortality that we attributed to this heat event. And for ozone, it was 0 to 1 day for the lag effect that we found. And for the confounding effect of NO2, it was just it was relatively short term as well. If I remember correctly, because we did that a long time ago, it's 1 to 2 days for NO2. I can check, but that's basically the main pattern that we found. Yeah.
Thank you.
Thank you. Any questions from the room?
I have one comment. That was super interesting, Tarik. Thank you. I just wanted to comment that a couple of the things that you showed, like your approach to looking at these spatially varying joint effects or interactions, or the fact that the proportion mediated can differ also across space. I think things that we often grapple with in epidemiology in general, also in social epidemiology, this notion that the effects of interactions themselves may vary as a function of other things, and also that mediation is not a natural fixed thing that can happen in different ways under different conditions. And I think that is really interesting to think about that. And I just wanted to comment that I thought you did it in a very elegant way, which is also understandable. And so I think that's really, really important contribution that can be applied to other kinds of epidemiologic questions. So just a thought on that. Thank you.
Thank you, Anna.
Yeah, another question in the chat by Wanji, who's asking, they will be interested in knowing a bit more about how extending the spatial extension of case crossover studies improves from the classical case crossover design. What they know, time series analysis can be more thoroughly adjust for time seasonality, or time trend and seasonality, but of course cannot be elaborated to a spatial extension. So there seems to be some trade-off. They would like to hear a little bit more about your opinion on this.
Yeah, sure. So first question, easy. The main advantage is that we can have a coefficient for each spatial unit, that when you do a traditional case crossover, time stratified also case crossover, you get an effect estimate for California. And of course, you can use zip code specific exposure, but at the end, when you run your conditional logistic regression, you get the odds ratio that is for California entirely. So the main rationale for us for developing this approach was to get estimates for each zip code. So that was the main rationale for doing this spatial extension of the case crossover. And then the distinction between case crossover and time series, at the end of the day, this is very similar designs. It's just that they just deal with seasonality in a different way. In case crossover, you basically deal with seasonality by just restriction on the same month and same day of the week when you do a traditional time stratified one, just to remove seasonality, long-term trends by focusing on the same months, and some kind of within week variability by matching on the same day of the week. So the reason for which we kind of started with this case crossover just because to be honest, it's totally feasible with the time series framework, and to deal with seasonality with like different approaches like spline function, etc. That's definitively feasible. The reason for which we did this is just I was more interested by this kind of matching procedure. And I like matching in general because it can allow to do some diagnostic checks, etc. And that's just the main rationale for which we chose the case crossover avenue. But it's definitively possible to extend the time series framework with a Poisson regression, for example, to a spatial way. And it has been done in other fields and but not to do this type of work, not to try to understand like synergistic effect on additive scale. Because that's the main innovation of this approach is to have an estimate for each spatial, like spatially varying coefficient, but also in relation to additive interaction. And but that's definitively possible in a time series framework, and that was just a preference from us to pick the case crossover.
There are no questions in the room. I actually have one for you, which is when you mentioned this idea of population level competing risks, which I really like this idea, how that sounds. And I'm trying to see how, is it different for example, what demographers call the cooling effect? You know, it's after a flu season, mortality goes down because everyone that would have died already died, essentially, right? And then I'm thinking, what are the consequences of COVID for that? Because we just had a huge cooling phenomenon in the last 2 years with more than 1 million deaths in the US. How will that affect future effects of heat, air pollution, all of these things?
Yeah, I obviously I don't know comprehensively, but we have some clues and some studies trying to show that. Do you know, it's a funny, like all of the kind of unintended benefits of the lockdowns and the COVID situation on other infectious diseases like influenza, they call that the lemon effect. Because in English, you have this expression, when life gives you a lemon, you make lemonade. And they kind of make these kind of unintended benefits of the COVID, the lemon effect. And so that's something that definitively has been documented. And then I think that will be definitely important. But I think it's COVID has so many mechanisms because so many people, for example, for cancer prevention, didn't do the screening as they should. They shall have in a context of like, if COVID didn't happen. So I think that will be in the next few years, it will be a disaster in terms of specific cancer that will be diagnosed way too late. Same thing for mental health. That I think there are a lot of mechanisms that I think will be disastrous in the next few years, unfortunately. But try to be like specific to that. I think there are a lot of these kind of unintended benefits, but also in terms of the immune system for children, for example, there is also a lot of literature trying to understand how not being exposed to a lot of infection at specific critical periods, like critical ages, may make some individuals, some cohorts, basically, a little bit more susceptible to specific infection or to air pollution and things like that. So that's what I know so far. But yeah, that's what I can say.
Thank you. Thank you for your crystal ball. Prediction. Hey, any last question from the room?
Doesn't look like it.
Okay, so I think we are at time, right? Exactly at time. So please join me in welcoming, thanking Tarik for his great talk. And if you are a student, I just put it on the chat and want to meet with Tarik, come back to this room in 30 minutes and we'll have a meeting with him. So thank you, everyone. And thank you, Tarik.
Thank you so much. Thank you, everyone.